You're now live. Have a good meeting.
Thank you, Christina. Good morning, David.
Morning.
Good morning. I'm Vice Chair Sarah Copley, and I'd like to welcome you to the July 29th, 2022 Homeless Initiative Advisory Committee meeting. This commission is composed of not more than 16 members representing the various focus areas or agencies, including philanthropy, Buncombe County, supportive and permanent housing, mental health or substance abuse, legal and educational, etc. The term of office is 3 years, and members are appointed by City Council and County Commissioners, 8 members each. This committee is also hearing monthly updates from the National Alliance to End Homelessness about their current project to conduct a comprehensive needs assessment on unsheltered homelessness and develop strategies our community can implement in response. All committee members and staff are participating virtually, and we are streaming live on our virtual engagement hub, which is accessible through the virtual engagement hub link on the front page of the city website. And it's also linked on our HIAC webpage. We also have an option for the public to listen live by phone. And for those of you who joined us today, welcome. I will now go through and introduce the committee members who are participating virtually. And as I call your name, please respond. David Bartholomew.
Good morning, present.
Lance Crawford.
Hi, present.
Elvia Diaz. Claire Hubbard.
Present.
Marcus Laws.
Present.
Justin Mailman. Okay, I'll come back to that. I got him last call. Tim McEllier.
Here.
David Nash.
I'm here.
Joelle Steininger. Jessica Supik.
Present.
Jennifer Teague.
Present.
Excellent. I'd also specifically like to welcome our 3 new members today, Claire Hubbard, Marcus Laws, and Dustin Mailman. So we'll go in alphabetical order by last name. Claire, if you would start and give us an introduction about yourself and your interest in HIAC, welcome today.
Hey, thanks so much for being here. I'm really grateful for the opportunity to work again with some of you and for the first time with others. I work for Buncombe County EMS with the community paramedic program. And I worked for Buncombe County as a paramedic for quite a while before that. And I worked as a nurse briefly, doing kind of forensic nursing or public health nursing. So I had kind of a merging of 2 backgrounds that spit me out doing kind of the combination of the 2, which is public health emergency response, essentially. And my interests come from those 2 backgrounds, from working with vulnerable populations in both of those fields, and just wanting to support however I can and help from the angle of public safety in any way that I can, and try to plug into all the other folks who are already doing a lot of the outreach and work in the field and know how we can support more.
Wow, well, thank you so much, Claire. Really welcome you and your expertise to HIAC today. Good morning, Marcus. I'd like to welcome you. If you could give us an introduction and a bit about your background. Thank you so much.
No problem. Good morning, everybody. My name is Marcus Laws. I am the Homeless Services Director for Homeward Bound. I've been here about 4 months. Prior to working for Homeward Bound, I was the Homeless Services Coordinator for the city of West Palm Beach, Florida. My background is in housing and vocational rehabilitation, specifically with mental health and homeless populations. My interest in HIAC is to help to build and improve systems and resources within the city of Asheville and Buncombe County to the best of my ability, and to partner with anybody who is willing and excited to do so to make that happen.
Thank you so much, Marcus. Welcome to the community. 4 months and you're already on a pretty important commission. We really welcome your expertise. And Dustin, I'm not sure if you got your audio worked out, but welcome this morning. Okay, so go on to our agenda.
Hey,
That is-
Sarah, I'm sorry
Yeah.
to interrupt you. I'll check in with Dustin. And also wanted to mention, I'm sorry I didn't catch this in advance, but Jessica, this is her first meeting with us as well. I believe she was appointed but not able to join last month. So might have her introduce herself also.
Definitely. Thank you so much, Emily. Welcome, Jessica.
Thank you, Emily. Thank you, Sarah. So my name is Jessica Supek. I am the Homeless and Foster Care Liaison for Asheville City Schools. I am going into my 4th year with the district. Before this, I was behavioral health and trauma-informed care. And I'm just excited to be part of this group, kind of see what we can do together to not only help our homeless population in Asheville City, but also our children and families who are being identified as homeless as well. So thank you, everyone. I appreciate it.
Thank you so much, Jessica. We welcome your expertise as well. And thanks, Emily, for welcoming. Dustin, are you able to join us and give an introduction about yourself this morning?
I just noticed on my camera anyway that it said he left the meeting, but
Thanks, Claire. We'll move on to the agenda. So if we can look at our consent agenda that was part of our meeting agenda today. Can I have a motion to approve the June 24th, 2022 minutes?
I motion to approve.
Thank you. Can I have a second?
Second.
Thank you so much. I did want to especially thank Jennifer Teague for jumping in at the 11th hour to chair that meeting in June while my candidate was being interviewed. So thank you so much for hosting that, Jen. Now I'd like to introduce our presenters, Christy and Josh from the National Alliance to End Homelessness. For those of you following today, their slides are available on the HIAC website. And they will be sharing the slides with us today. So welcome, Christy and Josh.
Thanks, Sarah. Thanks for having us. We're going to go ahead and I'm going to go ahead and share my screen, and then Josh is going to kick us off. So let's see if I can do this without.
Well, good morning, everybody. I'm not sure what the weather's like in Asheville. It's cloudy, a little colder here, but we always appreciate being able to join you all. Not only one to give an update on what's happening with the needs assessment in Asheville, but also to use this time as just like a way to just share kind of some baseline information, some knowledge. So when we do provide the needs assessment and the recommendations, you'll understand what kind of some of the language we're using and the framework in which we're trying to move this work forward. Last time we got the pleasure of meeting with you all, we really talked about what we meant by an efficient system, with what the goal was to divert folks whenever possible, but also move folks out of homelessness quickly. So we went through that whole system flow last time. And this time we're going to talk a little bit about just homelessness in general, like a very basic understanding of homelessness, the construct of COC, and kind of, why we work to address homelessness in the kind of the way we do. Again, I'm Josh Johnson. I go by he, him, his pronouns. I am identified Black African American. I am the senior technical assistant specialist with the Alliance. And I'm here with Christy, who gave a quick hello. If you want to just go to slide 5. All right, so I wanted to really just talk kind of briefly about like just homelessness in general, right? Like really getting the understanding of when we say homelessness, what we mean. What are the national numbers? What are the trends telling us? And just again to kind of continue to build on this baseline information. So again, by the time we have this robust report, in the recommendation, that baseline of information, what we talk about, we'll be like, oh, okay, I understand it because it connects with with the some of the information that was shared during some of the meetings. So I wanted to start with just the definition of homelessness, right? There are multiple definitions, right? There's multiple definitions of who is considered homelessness, but we of course use HUD's definition of homelessness. And with a lot of when we're talking about unsheltered homelessness, we're really looking at someone living in a place not meant for human habitation, right? As you know, there's 4 categories of folks who which primarily relate to eligibility and with programming, but also kind of fitting under those different categories of homelessness per HUD's definition. Again, there's multiple definitions, but this is the definition that we are utilizing. So when we say homelessness.
And Josh, I just want to add to that really quick, just because I know that Jessica is new to HIAC, and just so folks understand that the Department of Education has a different and separate definition of homelessness. It is equally important, but it'll how it plays out and it's implemented and how you choose to target resources and implement those resources is going to be a little bit different. So it's awesome that Jessica, you're on HIAC now, because the ability of connecting to students who and school systems that can identify people who are either homeless or families that are homeless, students that are homeless, or facing very severe housing instability. So it's great that you're on the HIAC now.
Absolutely. Thank you for driving that point home, Christy. All right. So the next piece is like, what causes homelessness, right? And I know that I'm sure you all who are working in this field in Asheville, you understand this, but it's not always understood by the general population of kind of what's causes homelessness. So homelessness is caused by a lack of affordable housing, and then with the lack of affordable housing, stagnant income, right? So housing, as we see recently, housing costs are going up, income is not, right? But we can point to a point in time in our history where our contemporary homeless crisis really started, when there was really a lack of investment in affordable housing, actually a cut in investment in affordable housing. Also, on top of that, right, like layering on that, you have the systemic racism, right, that leads to racial inequities, which we see the overrepresentation of black and brown folks in the homeless system. There's a decreased lack of health and healthcare access, right? There is, of course, survivors of domestic violence and intimate partner violence. There's those folks who are coming out of other systems, such as child welfare, justice system, and then there's those family conflicts, which usually intersect with affordable housing, lack of income. But what we love to talk about with this is it's not a individual failure, right? It's a system failure that leads to folks experiencing homelessness, right? So, because a lot of times when we talk about folks experiencing homelessness, we say, well, this person has AOD issues, but majority of folks who have AOD issues are not homeless, right? Per the data, right? This person has mental health, but majority of folks who have mental health issues are not homeless. So understanding that homelessness is actually a systems fail and not an individual fail is kind of how we address. And hello to the dog who I feel like was echoing what I was trying to say. So I really we always want to make sure we drive this point home. And so when we're making solutions, when we're trying to figure out how to address homelessness, it's not through each person needs to pull themselves up. It's more or less we have to get our system into a line to a way that addresses it in a way that really highlights the failures of the systems that's led to this in the beginning.
Thank you so much for that frame.
And so quickly, who is experiencing homelessness? We see the breakdown is mostly individuals. We have with some being people in family, 100. This is national data. As we know, chronic homelessness and veteran homelessness has been on the decrease, but chronic homelessness is still high. We have 34 or 34,000 unaccompanied youth. And again, this is using the HUD definition, right? As Christy highlighted, the McKinney-Vento, there's kind of a different definition that's used. That lots of the numbers are a lot higher, but this is for the HUD definition of homelessness. So just giving a snapshot of what homelessness looks like by breakdown. So we'll kind of go into this a little bit more as in the next couple slides. So this is just a breakdown, just really emphasizing the disproportionality, right? And this might look different in every community, right? Like when we pull, so like in the U.S., African Americans are 13% of the homeless population, but make up anywhere from, I've seen 39% recently, but over 40% in some studies of the homeless population. And again, that fluctuates depending on the community. But what doesn't fluctuate is that overrepresentation, right? There's a small representation of African Americans in the community, and it's either doubled or tripled in with representation within the homeless system. So what does that mean? We have to really look at how we're utilizing our intervention. Is it equitable? Are we using a colorblind approach? Are we being intentional with the services that we're providing? And so that's a lot of times why we use the equity lens, because historically there has been a lot of inequity with the work we've done because of a colorblind approach. So who is the largest group experiencing homelessness? It's 72% male. 47% of those folks are unsheltered. So that's non-chronic, non-veteran, 25-year-old, 25 plus males. These groups have the fewest resources, right? There's the housing, employment services, reentry support, recovery connection. So that's just a quick snapshot of the subpopulation that is the represented the most within homelessness. And then also just looking at it by gender, there's an 8.5% increase in homelessness by men from 2016 to 2019. There's a 35% increase in unsheltered women homelessness from 2016 to 2019. There's a 17% increase in women's experiencing homelessness. But also, what else is shocking is an 88% increase amongst folks who identify as transgender of experiencing homelessness within three years. So again, that's why that equity piece is so huge, right? There is a disproportionality, as we've seen specifically with youth homelessness, of LGBTQIA plus folks experiencing homelessness at a higher rate than their cis heterosexual counterparts. So again, the equity piece, the intentionality, the equity piece is crucial to the work we're doing to address homelessness. And then also a definition of chronic homelessness. This is the simplified definition: someone who has a disability, someone living in a place not meant for human habitation or emergency shelter, has been homeless for at least 12 months or 4 times in the past 3 years, totaling 12 months. So this is a small group of folks, high vulnerability, usually high public emergency system users. But this definition is great, and it's really meant to meet the needs of the highest need folks in our community, right? But what it is not intended to do is create chronic homelessness in order to access resources, right? So unfortunately, the byproduct of this is, and as a former case manager, you don't have so many options. So if I know this person needs to get XYZ in order to access permanent supportive housing, that might be a solution that some communities that I've worked in have taken. But what ends up happening is you're creating more chronic homelessness in order to get this precious resources out, when instead of trying to use other resources that will end their homelessness. So this is, again, for the highest need folks in the community. The chronic is the definition of chronic homelessness, which has access to permanent supportive housing. All right, I think that's anything else, Christy, that you wanted to throw in there?
Nope. I'm just going to add one acronym that we use, AOD. That's alcohol and drug use, or alcohol and drug use.
Thank you. No, thank you so
Yeah.
much. Christy and I we're trying our best not to use the homeless system jargon too much. And if there's anything that you want us to clarify, please stop us and let us know, because I can go and say it without even thinking.
Yeah,
all right.
we just spent 3 days at our national conference using acronyms like a second language. So we're trying to break ourselves with that. So I just want to quickly just touch on COC governance and kind of the history of that. So the reason why kind of this larger picture of the state of homelessness is because as homelessness increased over the last few decades in the country, maybe even more than that, it was clear that communities really needed systems in order to respond to this growing disconnect between wages and housing and rent. And so there was a lot of work done at the federal and state and local level to start thinking about how communities could operate more effectively, in a more coordinated and collaborative fashion. And so I'm going to give a quick history and a little bit about COC governance. So this is basically a quick history of who you all are as this committee, right? So HIAC is the COC governance committee. So this is just a little bit of information about where you came from, what you should think about as your role, and where some ideas and thinking about what your future might look like. So it all started with the HEART Act, which was enacted in 2009. That is the Homeless Emergency Assistance and Rapid Transition to Housing Act. And it did a few things. It elevated one of the permanent housing strategies that many communities use now to increase flow in their system, and that is the short and medium and kind of right now longer term rapid rehousing intervention. We all know now that Housing First as an evidence-based practice has been elevated as something that we know works to both quickly get people into housing at the same time that you are connecting them to the services and supports that they need to stabilize in housing. It drove performance in looking at like all of the money that the federal government and state governments were giving to communities. There was a lot more evaluation on how well and effective that money was being spent. What were the outcomes related to those investments? It elevated system coordination, specifically coordinated entry. And so that was because most communities were operating their homelessness programs as just separate individual organizations or advocates, where people, just connected to that particular program and would be served in that way. And what was happening, honestly, was that programs were tempted and often served those who were maybe not the most vulnerable in the community, because either they didn't have the resources to support those kinds of needs, and or their performance might look a little bit better if they were serving folks who maybe were, quote, easier to serve. So coordinated entry was an effort and in the spirit of having a centralized way that people entered into the homelessness system so that there would be equity among how resources were allocated to them, and also that we could identify who were the most vulnerable people in our community that needed to be served. And it also elevated stakeholder coordination and collaboration, which is represented in the various roles that you all play in the community, represented around this table of COC governance. So as I said, the reasons I shared already about why the HEART Act was passed and communities started coordinating was, honestly, it just was really a hot mess. Communities were, doing good things and well-intentioned, but were not seeing progress in terms of reductions in people experiencing homelessness in the aggregate, and or longer lengths of time people were experiencing homelessness, or they were returning to homelessness. So really looking for that coordinated effort. So these practices that have been elevated over the past 20 years or so have helped us to respond to homelessness better, and it has decreased up until kind of the pandemic. We were seeing significant decreases in homelessness in communities. So it also allowed us to look at communities and learn like what was working and what is not working to end homelessness. So a little bit about continuum of care governance. So the relevant organizations that that make up the continuum of care are typically homeless service providers. They are advocate organizations, and they are public-private agencies who touch on serving people who are experiencing homelessness. So there are some main duties that a COC governance structure needs to ensure happen, and this is by statute and regulation. So one is that as you come together as the HIAC, you are responsible for operating the continuum of care, right? Making sure that it meets all of those regulatory and statutory requirements that come specifically with federal funding, and then sometimes also with state and local funding. You are to designate an HMIS lead and to operate that HMIS, which you have done, and you have designated the city of Asheville to operate your HMIS. And then you are responsible for COC planning. And when I say COC planning, I'm not talking about just the consolidated application or the continuum of care NOFO that, by the way, is going to drop just about any minute. And it's not just those consolidated applications or application funding opportunities. It is the larger system structure of planning, what your response is going to be in the community to end and make homelessness rare brief in one time. So you can see these are typically the entities that make up the COC governance board and or membership of the continuum of care. And so you want to make sure that you're talking to the folks that are represented here, but also what are the needs in your particular community, and it might include, lots of other organizations that serve, for example, marginalized populations like BIPOC, Black, Indigenous, and people of color. It could be the LGBTQ community. It could be the people living with disabilities. So just ensuring that you're looking at all the needs in your community and that it's represented in your governance structure. So if you want to learn more information about your specific continuum of care, we'll put a little link in here. And you can get the lowdown on federal funding for the continuum of care. You can look at funding levels and awards and programs. There's a lot of really good information about your continuum of care on HUD's exchange. Thanks, Josh. So a little bit about fulfilling these duties of the continuum of care. When I was talking about operating the continuum of care, what you are all responsible for collectively is these 12 things on the slide. I'm not going to go into them, but you will have them, and certainly I'm sure they are part of the ongoing conversations you all have as the HIAC. But if there's anything on here that you're like, oh no, wasn't familiar with that, then this is the place. This governance structure is the place. And Emily, as the COC lead agency staff person, is there to support you and help provide information about this particular operations. So some of these things are statutory, like I said, are driven by regulation. So, holding meetings at least semi-annually, and that's not, I don't mean the governance board, that's the larger governance structure when you have kind of a membership structure. And there are some key things in here. There are ensuring that there are some written standards developed for certain federal funding program types, like, for example, rapid rehousing or permanent supportive housing. Other things like establishing, number 9, system performance goals, incentivizing performance, and reallocating to higher performing providers. That isn't just in your COC NOFO competition. That's something to be thinking about year round. So I'm not going to go deep into what fulfilling these duties looks like on the kind of the day-to-day or the month-to-month of the annual planning. It's just a snapshot to show you that these are the things that you should be thinking about as you operate the COC. So like I said, designating and operating an HMIS. An HMIS is the Homeless Management Information System. It is the main database that all agencies that receive continuum of care or emergency solutions grants funding from HUD are required to participate in. Now, as a COC governance body, you all should be talking about how do we get anybody, any agency that is serving people who are experiencing homelessness, how do we support them? How do we incentivize them? How do we help build the understanding that collecting the data that goes into HMIS is going to help you as a governance board and the community and your elected officials to better understand the story of how well your efforts are towards ending homelessness. So even though there are federal requirements for certain agencies to participate, it is really on you as the governance board to support the lead agency and providers in the field in your community to participate, so that you know that you have as close as best to the picture that you can have on quantitative data in how well your homeless service programs are serving people who are homeless. So there are some like kind of main things in addition to operating what an HMIS is, and they are here. These are things obviously you'll be checking in, and Emily would be raising with you throughout the year. The COC planning that I was talking about is, as a COC governance board, ensuring that there's a coordinated housing and service system that meets the needs of those experiencing homelessness. So your role goes, again, way beyond just reviewing project applications and allocating funds. It is much broader than that. The act of doing that is typically done within a larger planning process that's ongoing throughout the year. So you already know that you're the lead agency, but the governance board really is the one who's responsible for ensuring that there's a point in time count that is planned and conducted, that you are ensuring that there is some annual evaluations, kind of gaps analysis of what the needs are in the community for those people experiencing homelessness, and whether or not the services that you're offering correspond and are better targeted and aligned to those needs. You actually do provide information to a much larger consolidated planning process that is taken on through county government and city government. That's called the Consolidated Plan. And you should ensure that the homelessness picture and needs is represented in that Consolidated Plan. And you want to make sure that, which since the Emergency Solutions Grant funding in your community comes through the COC lead agency, which is the city, there's not a disconnect between consulting on emergency solution grant recipients and plans for allocating that money. But that's there because in some communities, the recipient of the ESG funds is not always the same entity as, say, the COC lead agency. And there's not, you believe it or not, there's oftentimes not coordinated and a collaborative conversation about how that funding gets done in relationship to, say, for example, continuum of care funding. So these are kind of some main core duties around COC planning that you as a governance board are responsible for. And then last is the Continuum of Care Program Consolidated Application, which I've been referencing, and that's your COC NOFA or COC NOFO. That is definitely one of the key things that you all participate in every year. And we just encourage you, as you move forward in building your system's capacity, that process, which will be coming up for you folks who are new to the HIAC, you will get the lowdown on this consolidated application over the next few months. But the idea is that process, which is a pretty significant process, is a part of a much larger planning and evaluation period that you're doing. I don't know if someone can tell me how much time I have, or if I should be done like any minute. Sarah, where am I at on time?
You have 2 minutes.
Okay, great. All right. So I'm just gonna just in the deck are some slides around like who funds homelessness assistance in your community, like where does the money even come from? And the next few slides cover some of the main federal funding sources. I won't go into it here, but these are explanations of what that continuum of care funding looks like nationally. And Emily will, like I said, be introducing a lot of you new folks to what that funding is going to look like in Asheville over the next few months. But it is quite a bit of money, and it has grown every year to address the need. And we're always working to ensure that those funding levels at least remain the same and or are increased. The other major federal funding source is the Emergency Solutions Grant, and that funds more the crisis system, right? So continuum of care funds typically fund planning. that coordinated entry system, the homeless management information system, and permanent housing interventions in your community like rapid rehousing and or permanent supportive housing. The Emergency Solutions Grant is the funding that is dedicated towards the crisis part of your system, which is the emergency shelter, street outreach, homelessness prevention or diversion, and it also funds rapid rehousing. So you want to look at all of these funding sources and think like how best and well positioned and targeted are they together to address homelessness in your community. There's also a couple other major funding sources that within the nation, but specifically in Asheville, one of them being HUD-VASH, which is so HUD and the Department of Veterans Services came together and married and put together this awesome permanent supportive housing program for veterans, and HUD-VASH is very well executed in your all's community and is a great model just in terms of how permanent supportive housing can work. And then, of course, as you know, private foundations, state and local dollars often make up a significant part of that. So again, the next slide is just a few more other federal agency funding that you as a governance structure want to be asking Emily, how are these funding sources, what available homeless program assistance that comes through these funding sources and might be being pushed through other county agencies or other city agencies? Are we talking to them about how that money is spent and how it's coordinated with our overall strategies to end homelessness? So you always want to be asking that question. I have put time for Q&A in here, but I don't think I have it. But I do want to just end with what's next. Right now, we have about 4 surveys out in your community. We've got surveys out to people experiencing currently experiencing homelessness or having recently experienced homelessness. And I just want to put a shout out to Eric Hall and Pip Flickinger, who have helped us. And we have almost close to 100 interviews with people who are currently homeless and or experiencing homelessness. And so that's great because honestly, the data is on unsheltered homelessness in Asheville is not fantastic. So these qualitative interviews are really important. So we also have surveys out to many of you that we asked to put out to system leaders, senior leadership of homelessness programs or city agencies or county agencies that work with people experiencing homelessness, health and hospital systems. So we're trying to drive out a systems leadership survey. We have a survey that is being sent out to homelessness services provider staff. So like anywhere from like a person doing intake to a supervising case manager. We also have a survey out for the general community, and it is for residents and or property owners of people in Buncombe County. And so that is on the up, or should be up. I think Emily will probably update us on that being out on the city project update page. And also Vic Isley and Kit Kramer from the Asheville Tourism Association and the Chamber of Commerce they helped us design that survey, as well as, Rick from the neighborhood I'm going to get it wrong, but the larger neighborhood association helped us develop that survey. And so they're pushing that out as well. Josh and I will be back in town in a couple of weeks to do some focus groups. And we, there it is right there. Emily just put it in the chat. And then we'll be making these project updates to the project page. And then of course, joining you every month moving forward. So that's where we're at. Thanks, Sarah. I apologize for going over time.
That's right. Thanks, Christy. Thanks, Josh. Appreciate your time this morning. And now we'll turn it over. This is a great segue to Emily for staff updates.
Thanks. Good morning. Just two updates for me. One is perfectly aligned with what Christy just said. So the project page for the work that Christy and Josh are doing with our community is live on the city's website as of yesterday. So that's viewable. There's a link to that on the HIAC website if you're there, or also on the homeless strategy page. I also sent that link to go out to the Homeless Coalition. I think that's not happened yet, but hopefully that will happen today. So want to be sure that folks are aware that that project page is there. It gives some background on the project, links to some of the documents that are related to the project, and describes what the phases are. and what the timelines will look like. And again, describes the same thing Christy just mentioned about community participation, what those opportunities are, and how to be involved in that. And the link to the survey for community folks is on the website. Would really love your help in getting that out to folks in your network. If you can forward that out to people who may not have already seen it, who may not be on the Homeless Coalition distribution list, to be sure that we get really good participation across the community so that Christy and Josh have the best information possible to really understand the needs of our community that can help them inform the strategies that they'll be developing. Second thing for me is, I believe that you all have seen this, but we have, we're hiring 3 positions in our homeless strategy division. So those are all homeless strategy specialists. Those have all been posted last week and are open until August 21st. Would again love your help in getting the word out in the community about those opportunities, really hoping to build a very strong team in our department to help lead the response to homelessness in our community. All 3 of those are homeless strategy specialist positions. One will be focused on data and compliance, one focused on training and development, and one focused on integrated health and housing. I believe I sent the links to those to all of you, but am again just asking for your help in getting that word out to the community so that we really have a strong applicant pool and can really build a strong team. And those are the only updates for me. I am happy to answer any questions.
Thanks, Emily. Does anyone have questions for Emily? No, okay. Thank you so much. I'd like to talk a little bit about the work groups that we've established, the nominating work group, keep saying committee, I have to work on my language, the Code Purple work group and the finance work group. Jen, if you could give us a brief update from the nominating committee.
Okay, great. Thanks. So as you can tell that we've been working hard. We have 4 new members on our call this morning and glad to see them. Thank you so much for your interest and willingness to join us. We did have other interest in the position. However, as Christy went over, there are specific segments of population we'd like to have and should have on this committee. So Emily, correct me if I'm wrong, but I believe we have 2 open seats at the county right now and all city seats are filled, correct? Oh.
We have 2 open city seats, but the nominating work group has put in recommendations for both of those, and both will be considered for appointment, I believe, at the August 23rd council meeting.
Okay, thank you for that reminder. And then again, we do have 2 open seats with the county, and we are still missing a couple of the areas that Christy reviewed and that we've talked about as a nominating committee. And so we are reaching out to community members. Those 2 specific are individuals with lived experience and also the medical community representation.
Thank you so much, Jen. A lot of work from the nominating committee. Thank you so much to our new members, especially for being willing to join at a really pivotal time for our community, I might add. And
Sarah?
I'd like, yeah.
If it's okay, I just have I have 2 other really quick things. One, we are still seeking additional members to join the nominating committee. So if any of you, especially new members, are interested in serving in that role, we are meeting about once a month, and then we may not need to meet that frequently once we get the committee filled. But we would love to have you join us. So please reach out. And then I meant to mention this right after Christy and Josh finished, but and I'm sorry to do it kind of at this point. I think we actually need to have a vote on the consent agenda. So I don't know like where we all vote is my understanding. I'm not sure about all of the steps that occur, but I just at some point I think we need to do that.
Thanks for jumping in, Jen. We can have a vote. It was accepted. We had a motion and a second to accept it. We can certainly vote. So let's do take care of our business quickly. So this is a vote to accept the consent agenda that was motioned and seconded. David Bartholomew,
Yes.
Lance Crawford,
Yes.
Claire Hubbard,
Yes.
Marcus Laws,
Yes.
Dustin Mailman,
Yes.
Tim McEllier,
Yes.
David Nash,
Yes.
Jessica Supik,
Yes.
and Jennifer T.
Yes. Thank you.
Thanks so much, Jen. Appreciate that. And Emily, I'm going to turn it over to you for an update about the Code Purple work group.
Thank you. So the Code Purple work group has formed and has not yet met, but will be meeting on August 9th. And I think we have a really excellent group of folks participating in this to work on the plan for the coming season. That is going to be shelter providers who have participated in Code Purple in the past. So that'll be Tim, who's on the call from ABCCM, Dustin on the call from Trinity United Methodist, Michael Woods from the Rescue Mission, and Evelyn Ball from Salvation Army. And then we'll also have Melanie and Kevin, who are the incoming co-chairs of the Homeless Coalition. Claire is going to be on for community paramedics. Mike Lamb from APD is going to participate, and then Jen Teague from the county. So really great mix of folks who are HIAC members and community folks, and great mix of folks who are really deep in the work of Code Purple as it occurs. So I'm excited to get that planning underway August 9th, and then we'll be able to give you an additional update at the August meeting.
Thanks, Emily. That's such a great, robust group. I'm really looking forward to hearing what comes out of the work group, especially because we're starting earlier than we did last year. And if I could have an update from the Finance Committee, I know that you all met this week.
Hey, Sarah. Yeah, I'll jump in briefly. We were able to meet. We had two things on the agenda. The main thing was to talk about scorecards for the upcoming ESG grants. So Emily sent us a few to look at, and we reviewed some other scorecards, and then had some discussion about making sure there was acknowledgement of racial equity efforts and gender equity efforts, and that we were going to have that on the scorecard, but also try to make it simple so that people trying to get letters of intent and applications in pretty quickly would be able to comply with that, and the scorecard would be easy to understand how we were going to use it. So we're still sort of working on that. Emily sent out a draft, and we're going to try to get that back out next week. And then we also discussed very briefly the NOFO opportunity for the supplemental funding. We discussed that a little bit last week. And just our general agreement that we're not really at the place to apply for that right now. We're not sure how competitive we would be, and there's a lot of other grants that we're trying to focus on right now with new staff on the way. Maybe in the future, this opportunity will be something we can apply for. So I think that's mostly what we talked about.
Thanks, David. I really appreciate all the work that's gone into the scorecard, especially the mention of and focus on equity. The scorecard for the community is really how we're going to assess applications. And so that's really important for the Finance Committee. They've looked at our standard performance measures that HIAC has reviewed this year. And I just think the alignment of that's going to really help us, particularly when the recommendations from the consultants come in the future for starting with this foundation. I appreciate that. That's a great segue. David, I'm going to turn this over to Emily to talk about two funding opportunities, the Emergency Solutions Grant and the Special Notice of Funding Opportunity, or NOFO.
Thank you. And Christina, if you'll share those slides for me. I'll just say while she's pulling those up that you all heard Christy mention earlier that the Continuum of Care annual NOFO will be coming out imminently. I don't know if you saw me start sweating when she said that or not, but that is on the way quickly. So certainly at our meeting next month, we'll have an update about that. That's not yet been released, but should happen just real soon. In the meantime, we do have two funding opportunities, should happen today. So again, in the meantime, we have two funding opportunities to review, and these are the two that David just mentioned that we discussed in the finance work group this week. The first is the Emergency Solutions Grant, and I wanted to just share a few slides with you, particularly since we have some new folks on the committee. Want to be sure that you have familiarity with what this funding is and how it works and what HIAC's role is in participating in this process. So Emergency Solutions Grant, or ESG, is annual HUD funding that's available to our Continuum of Care, administered by the North Carolina Department of Health and Human Services. So this is federal funding that comes through the state ESG office and then to the local level. City of Asheville staff, so at the moment that is me, only me, City of Asheville staff, and you all, HIAC, are responsible for the process around the Emergency Solutions Grant application and access on behalf of our continuum of care. So I will facilitate that application process this year. And as applications are received, HIAC's finance work group, which I believe you all know this, but just to clarify, it has 3 HIAC members. So that is David Bartholomew, David Nash, and Lance Crawford, and then also has 1 community member, and that's Jamie Benshoff. I don't know if you all know Jamie. She's been a really active participant in the Homeless Coalition, has lived experience of unsheltered homelessness and sheltered homelessness, and is currently in permanent housing. Been a really great addition to that work group. So the finance work group reviews applications for ESG funding and makes funding recommendations to you all, the full body of HIAC, for approval. And then city staff submit those applications along with your recommendations and an accompanying regional application that we'll put together describing the continuum of care activities. We submit all of that to the state ESG office, who makes final funding decisions and then contracts directly with awarded applicants. Next slide. Eligible applicants for Emergency Solutions Grant funding are nonprofit and government agencies, and eligible activities with ESG funds are street outreach, emergency shelter, that can be both services and operations meaning things like utilities, just kind of the nuts and bolts of operating a shelter, rapid rehousing, homelessness prevention, and HMIS. ESG runs on a calendar year. So in 2023, our continuum of care is eligible for $128,187. And of that total pot of money, no more than 60% can be awarded to emergency services. So that is street outreach and emergency shelter. And no less than 40% can be awarded to housing stability. So that's rapid rehousing and homelessness prevention. Next slide. As a reminder, and again, for folks who are new on HIAC, our 2022 Emergency Solutions Grant funding has supported caring for children with the Trinity Place Shelter, which of course closed recently, Helpmate for both emergency shelter and rapid rehousing for survivors of domestic violence, and then Homeward Bound for homelessness prevention. And you can see in 2022, we had about $500 less than we will have in 2023. So a very similar amount of funding available for the coming year. Next slide. It's just an overview of the process and timeline, and hopefully you all have seen this. This has been distributed, I think, pretty widely across the community. So I sent the notice out last week, July 21st, sent that out through the HIAC distribution list to the Homeless Coalition, and it's posted on the city website. Christina sent that out to the community development distribution list. So hopefully really trying to cast a wide net and make sure that folks across the community are aware of the funding opportunity. Letters of intent will be due on August 19th. And on September 9th, project applications will be due from organizations. And those will come directly to me, and then I'll share those with the finance work group to review. On September 15th, applicants will be able to do a 5-minute presentation to the finance work group. That'll be a virtual meeting. And then the work group immediately following that will sort through their recommendations. We'll notify applicants of those recommendations on the 16th. And then tentatively, the finance work group will present their recommendations to you all, to the full HIAC, for approval on September 23rd. That's a change from your regular September meeting date. And that's a later agenda item this morning, is to look at potentially shifting that September meeting date. September 27th, we'll ask for revised applications to be due, meaning if agencies were not recommended for the full funding that they initially applied for, then we'll ask them to revise those applications to match the recommendation. Those will come back to me, and then project applications and that regional application will be submitted by October 3rd to the state ESG office. In November, they will announce those funding decisions, and then they'll move forward with contracting with awarded applicants for the 2023 calendar year. It's very, very sort of quick and basic overview of ESG and the process, and I want to pause right here and see if folks have any questions about that. No, everyone's.
Sorry, Emily, I couldn't get unmuted fast enough. This is Jen. Since some of the funding was for Trinity Place for this year, and as you said, they've closed, what happened with those funds?
I don't know, actually. That's a good question because those contracts don't route through the city. They're directly between the state and the applicant. I am happy to find that out and report back to you all. I would guess that either they fully expended their funds prior to closing the shelter, or that any unspent funding would have reverted back to the state. But I'm happy to follow up on that.
Okay, thank you. So then in theory, that would also mean that for the next year, there could potentially be $20,000 that had not been previously earmarked. I understand that the funds could be allocated to anyone who applies and meets the criteria, but that could potentially mean either a new provider and or additional funding for a current provider. Is that because you do not anticipate Trinity Place applying again in the future, or?
Right. I'd say it's certainly accurate that we, for the 2023 process, will not have an application from Trinity Place. Any other questions? Okay. Next slide, Christina, thank you. So the second funding opportunity I wanted to share with you is what David had mentioned in the finance work group update. This is HUD at the federal level has released a special notice of funding opportunity related to unsheltered and rural homelessness. And this NOFO came out 2 days before our last meeting last month. And so I mentioned it at that meeting, but didn't have much information at that time. So I wanted to walk through what that funding opportunity is, what the eligibility is, what the process would look like, and then ask you all for a decision about how we move forward with that opportunity. Next slide. So this is Continuum of Care funding, and I know that many of you are familiar with Continuum of Care funding. Again, some of you are new. This is a different version of Continuum of Care funding than we are typically accustomed to. So this is special one-time funding using recaptured Continuum of Care funds from prior competitions. And the specific goal of this funding opportunity is to reduce unsheltered and rural homelessness. The rural homelessness component of this is specific to some geography, doesn't apply for our Continuum of Care. So for us, the unsheltered portion is the relevant portion of this funding. The process for this would generally be the same as the annual Continuum of Care process, although it does have some significant additional requirements, and I'll talk about those in a minute. Our Continuum of Care is eligible for $820,850 max, and that would be over a 3-year period. And it's possible that after 3 years, projects could be renewed as part of the ongoing and annual Continuum of Care funding opportunity. Certainly not guaranteed, but certainly a possibility. But again, the intention with this is that this is special one-time funding using recaptured Continuum of Care funds. Next slide. The eligible activities are the same as the eligible activities you're familiar with Continuum of Care funding. So those are permanent housing, meaning either permanent supportive housing or rapid rehousing. There's a project type that is that we don't have in our community, have not historically had in our community, that is a joint component of transitional housing and rapid rehousing. Supportive services only is a project type that's eligible with this, and examples of that could be street outreach or coordinated entry. HMIS is eligible, and then there's a 3% planning component for the collaborative applicant, which is the city of Asheville. Eligible applicants for this are nonprofit and government agencies, so same as ESG. And October 20th is the submission deadline for the Continuum of Care. Part of the prescription from HUD in this NOFO is that project applications must be due at least 30 days in advance of that. So it would be due September 20th at the latest. And then this is competitive funding on a 100-point scale. And I'll talk more about, I'll break down that funding in just a minute, or I'm sorry, that scoring in just a minute. Next slide. HUD has 6 policy priorities with this funding. Those are to address unsheltered homelessness, so to identify people who are unsheltered, connect them with health and housing resources, and enhance HMIS for better data on unsheltered homelessness. Second is involving a broad array of stakeholders in the COC's effort to reduce homelessness. So inviting a variety of stakeholders to develop and implement a continuum of care plan to serve individuals and families experiencing homelessness with severe service needs. I'll go into that more in just a minute. Advancing equity is a policy priority with this funding. So the charge is to review strategies to support and serve underserved communities, identify barriers that led to service disparities, and take steps to eliminate those barriers. And then to use a housing first approach. So projects funded through this NOFO should help people move quickly into permanent housing. There are two additional policy priorities that, again, just don't apply for us based on our geography, and those are rural homelessness and providing assistance on tribal lands. Next slide. So again, this is competitive funding on a 100-point scale. So I'm going to just walk through how those points come together. There are 4 points available for project capacity, review, and ranking. That means using objective criteria and past performance to inform how projects are reviewed, or are ranked, and then what that ranking and selection process is. So this is similar to what we just talked about with the ESG process, where the finance work group is involved in reviewing applications and making those initial recommendations to you all for consideration. 8 points are available for coordination and engagement. So that is an inclusive structure and participation, coordination with federal, state, local, private, and other organizations, discharge planning, collaboration related to children and youth, and mainstream benefits and other assistance. So how are we as a continuum of care pulling all of these pieces together to best serve people experiencing unsheltered homelessness? 18 points are available related to system performance measures, and specifically looking at improvements in the performance of our system. You all will recall that in March, I believe, just a few months ago, we reviewed our system performance measures for the prior federal fiscal year, so our most recent submission. Specifically, what these points are tied to a 5% reduction in homelessness in the 2020 point in time count compared to 2019, a reduction in occurrences of first-time homelessness, and a strategy to reduce first-time homelessness, a 5% decrease in the length of time homeless, 5% increase in exits from homelessness, so permanent housing placement and retention, 5% decrease in returns to homelessness, and then an increase in income, and that's both employment and non-employment income. Next slide. So the majority of points in this 100-point scale are related to that plan that I mentioned at the beginning. So 70 points related to the Continuum of Care's plan to serve individuals and families experiencing homelessness with severe service needs. Components of that plan need to describe how we would leverage housing resources, so having a commitment of new non-COC funded units available, how we would leverage healthcare resources, describing our COC's current strategy to identify, shelter, and house people who are unsheltered. So outreach efforts, how we provide immediate access to low barrier shelter, and how we provide immediate access to low barrier permanent housing. And then updating that strategy to identify, shelter, and house folks who are unsheltered based on data and performance. We also need to describe how we identify and prioritize households with unsheltered experience, how we involve people with lived experience in decision-making, and how we support underserved communities and equitable community development. Next slide. And then lastly, there are bonus points available based on the number of folks who were unsheltered in the Continuum of Care in 2019. So you'll see that the COCs with more than 1,000 people who were unsheltered in 2019 are eligible for bonus points based on just the severity of need in those communities. Our 2019 point in time count identified 78 people who were unsheltered. And as you know, even in our 2022 point in time count, where we've seen a significant increase of folks unsheltered, we had 232 people. So would still be in that lowest tier. I'll just highlight that that's a good thing. You know, we don't want more than 1,000 people unsheltered in our community, but we would not be receiving any of those bonus points. And I think HUD's objective with this particular funding opportunity is to really target, of course, is to really target unsheltered homelessness in particular, and communities that do have high rates of unsheltered homelessness. A change in this continuum of care funding compared to our typical continuum of care funding is that collaborative applications will be prioritized by score and fully funded until all funds are allocated, meaning basically meaning your continuum of care receives full funding or receives no funding for your application until HUD runs out of money. Y'all, I will pause in just a minute to answer questions if any of this is not making sense. So that is a change in that with our annual continuum of care funding, we are certainly not guaranteed that funding, but we are almost guaranteed that funding. This is money that renews year after year. We may not receive full funding, but are accustomed to generally receiving the majority of funding that our COC is eligible for. The difference with this special NOFO is, again, that COCs will be fully funded until all funds are expended from the federal level or allocated. And then lastly, no more than 10 COCs will be funded in any state. HUD's aim is to have geographic distribution with this funding opportunity. So no more than 10 COCs per state will receive funding. Next slide. The requirements for this special NOFO include the community plan, which I just described, so it's up to 15 pages, working through those particular details. Written commitments demonstrating the number of new units to be developed or set aside and the date by which they'll be available. Written commitments from healthcare providers with the types of services being made available, the value of those services and the dates. A letter of commitment from the Housing Authority to pair vouchers with COC-funded supportive services and develop a plan to prioritize vouchers through coordinated entry for people experiencing homelessness. And then a letter of support for the community plan signed by a working group of people with lived experience of homelessness. Next slide. So some considerations, and this is my last slide, so we'll open it up for questions and discussion after this. Some considerations from my perspective are, the positives in this are certainly that this is a new resource related to unsheltered homelessness. We have a significant need in our community around unsheltered homelessness, and these are additional dollars targeted to folks who are unsheltered. A number of the requirements in this funding are requirements that our community currently does not meet. So these are structures that we don't have in place right now. For example, we don't have a working group of people with lived experience of homelessness. We certainly do need that in our community. So some of the positives here are that these are things that we need to put in place regardless. And then again, the COC NOFO will be coming out today. And so some of this work is potentially work that we could also use in that annual competition for COC funds. Some of the things that are challenging about this funding opportunity are just staff and community capacity, particularly with ESG and COC applications open concurrently. We are potentially not a highly competitive continuum of care for this funding based on the size of our unsheltered population in 2019. And again, we are missing just some key building blocks like that work group of folks with lived experience and some of those other partnerships that are critical in describing in this continuum of care opportunity. Very tight timeline for this particular funding. I think some additional considerations are that we would need volunteers to really commit significant time to developing a community plan. And I will say that I held a community meeting on July 11th and really cast a wide net, and that really invited a number of folks. All of you on this call, I believe, were invited to that. And I also included homeless service providers, healthcare providers, some folks with lived experience, really tried to include as many interested community people as possible in this discussion. We reviewed the same slides that we're looking at right now about what this funding opportunity entails. And in general, the input from that meeting was, I would say, pretty consistent across the board, that folks felt like this is a resource that we need in our community, and also that it would be maybe prohibitively challenging for us to put together the structures and the plan that we would need in place in order to apply on that timeline. I think David Bartholomew is on this call and was on that call also, so he can maybe speak to that from his perspective. I'm going to wrap up there and ask if you all have any questions about any of this, and then ask for some discussion about how we move forward. Questions? David, could I ask you to share from that community meeting on the 11th, just what your
Sure. Yeah. Yeah. Thanks, Emily. Yeah. So I did attend most of that meeting, and there was a lot of discussion, a lot of people talking about, after Emily sort of addressed sort of pretty much this presentation about the positives and negatives and where we are as a community with this opportunity. And the consensus really was that this is something we need to be able to do in the future, because obviously we have a huge need here for this funding. And this would be something that we think would be really helpful, that we could put to good use. But that, because it's a very competitive grant and there's a very short turnaround, that we aren't ready. And so that's something to make sure to note. And the consensus really was from, at least 6 or 7 people chimed in and with agreement that we should, not use the resources right now that we have for this opportunity, but focus those on the other ones. So I think that's definitely what I heard. I think some other people on this call might have been there too, but.
Thanks, David. Does anybody else want to weigh in about the community meeting? Any questions about the positives or negatives? Unfortunately, those bonus points are pretty significant that we would not be able to access also, just from a grant's perspective. Emily, you also, the HIAC needs to vote on the special NOFO, is that correct? Great. So given those pros and cons, anyone really want to devote a lot of time to pursuing this application, because it would take volunteers like us from this group to be able to do that? Is there anyone who's able to do that at this time? Again, the points were it's going to be difficult to overcome. Can I have a motion from the committee that we'll delay this to another time?
I'll make that motion that we focus on some of the prerequisites possibly for a future application, but not prepare our submission for an application.
Thank you for the clarification, both Davids. The outcomes on what we do need to be doing is an important point. Can I have a second?
I'll second. This is Tim.
Thank you, Tim. All right, we do need to have a vote, so I'll go by roll call. David Bartholomew?
Yes.
Lance Crawford?
Yes.
Claire?
Yes.
Marcus?
There might be
Dustin?
yes.
Thank you. Dustin?
Yes.
Tim? You offered the second.
Yes.
David?
Yes.
Jessica?
Yes.
And Jen?
Yes.
Thank you for the presentation and all the work from the community that went into really assessing this opportunity, so we know where to go in the future. Going down our agenda.
Hey, Sarah, I'm sorry to interrupt. Can I just round that out? Thank you all for your vote. And I do want to say that I really would like to see us work on getting funding ready so that we're able to take advantage of opportunities like this that come along. I think we're having similar conversations on other fronts. We've had this healthcare and homelessness work group that has met a couple times, and we've had a similar conversation there about needing to build out some partnerships and plans so that we are ready to take advantage of funding opportunities as they arise. Also, is the same conversation around youth homelessness, trying to work on building some of that infrastructure so that we have the data that we need, we have the plans that we need, we have the community participation that we need. So I hope that we'll continue to move in that direction. I do think a really good step that we can take now is working on developing that work group of folks with lived experience. I had already had that in our divisional work plan for this fiscal year, and would love to see if there are a few folks in this group that might work with me on that. At the moment, what I would envision is just like an initial sort of brainstorming meeting to put together kind of a framework that we could maybe bring back to HIAC for some consideration. And I can follow up with you all about this also, but I am really interested in seeing that piece in particular come together quickly, as quickly as possible.
Thanks, Emily. And with Christy's feedback also of needing more feedback from folks with lived experience, I think that would really inform our decisions also. Jen, you have your hand raised?
Yeah, I was just going to say that I also think we are laying the groundwork by having the consultant. And so to me, it did feel like hearing from what the outcome will be from the National Alliance to End Homelessness, I think will also help us develop the plan that was requested kind of in this proposal. So it felt like we are putting those steps in place to be able to be prepared for when these future opportunities do come.
Thanks, Jen.
Can I comment briefly too? I think putting the steps in place for a federal grant is a good idea, but I also think we could consider using the model to some extent and putting together a funding application from local sources that would be more likely to be successful and help us implement what we could possibly have implemented with this federal funding.
Excellent point. Tim, you also have your hand raised?
Yeah, I agree with David. And I think that, it's just a matter at this point of, pulling those resources together. They're all there and that sort of thing. And Emily, I'd be happy to, work with you in that capacity.
Thank you so much, Tim. That'd be really valuable. Anyone else have any questions or comments for Emily? Thank you so much. Our next agenda item is a proposed change of our September meeting date, which was to be September 30th. Emily's requested we change the meeting date to September 23rd, also a Friday, in order to vote on the ESG recommendations in time to submit them. Can I have a motion to accept the change from the 30th to the 23rd?
I motion to accept.
Thank you. Can I have a second?
This is Jen, second.
Thank you, Jen. We'll do a quick vote. David Bartholomew,
Yes.
Lance,
Yes.
Claire,
Yes.
Marcus,
Yes.
Dustin,
Yes.
Tim,
Yes.
David Nash,
Yes.
Jessica,
Yes.
and Jen.
Yes.
Thank you. We will move our September meeting to September 23rd in order to meet those requirements. To our next agenda item, officer elections. We received an email from Emily. We've been operating without a chair. This situation came about because the city was looking at a restructuring of boards and commissions. So I had agreed with Emily's predecessor, Brian, to serve as vice chair until that change was made. We were hoping that was going to be July, but that won't be the case. So I've talked to some of you about your interest in being an officer. We really need a chair to handle new business. So obviously moving forward, that's going to be really important. And we have a couple of members that have understandable conflicts. I'm one of those myself. We want to make sure that nonprofits are protected in funding. So I'm just going to go over the terms. The terms are 2 years, and the chair can serve no more than 2 consecutive terms. And instead of voting today, which has been my hope, some of you are considering this at the time and have some more additional questions for Emily and myself beyond what's shared in the bylaws. So given that concern, and also that we are missing our other appointments from the city that are going to be considered in August, I'm going to table this until our September 23rd meeting, where we'll formally be able to elect our officer. I also want this to go through the nominations committee. That's sort of been a missing link in our nominations work group. Has just done such an amazing job with nominating and really orienting new members to HIAC. I'm going to recommend as your vice chair that we proceed with that so that we have certain leadership. Everyone's educated on what the requirements are. So hopefully in September we can have a leader for 2 years and move through that. So thank you so much to everyone I've talked to about becoming chair. Really appreciate you considering it. We've had some resignations from HIAC this year due to COVID, work changes, and other things. So I really appreciate every member who continues to show up and bring everything you can. We will need a chair. So again, we're going to vote on September 23rd. We'll work on that nomination with the nominations committee. Any questions, concerns, comments at this time? Okay, thank you. And I'd like to offer this to our last agenda item, which is opening it to public comment. Christina, I'll turn it over to you to see if you have any calls or messages.
We do not have any calls or messages.
Thank you so much. Anyone on the line have any questions?
No, we do not have anyone on the line either.
Thanks, Christina. Can I have a motion to adjourn this meeting of HIAC on July 29th, 2022?
I'll motion to adjourn.
Thank you. Can I have a second?
A second.
All right, our business for today has concluded. Thank you for your attendance, and I look forward to seeing you in August. Thank you for your time.